Here we go.
Turn it off?
Nah.
What happened?
I thought I pressed earlier, but...
You have it on.
Yeah, it's on now. Okay, we're good.
An angiospasm. An angiospasm is when, well, it's a muscular spasm in the wall of a blood vessel. So it's when this blood vessel squeezes, the muscles around it squeeze and closes down the vessel. Here's a normal artery, here's a vasospastic artery.
What is angio?
Angio is heart or blood, I think. Good question. It's Latin or Greek. So if the blood vessel spasms, this closes up. That's what happens when you get injured. So it'll spasm to help stop the bleeding. This is an arteriography. Arteriography, injection of radio-opaque solution into the vascular system for X-ray examination of arteries. So they've injected a substance that leaks out radiation. And it's not enough radiation to hurt you, but it's enough radiation for the machine that they put you in to pick it up so it can see the blood vessels. See if any of them are blocked up. Isn't that cool? Arteriography. Asystole, failure of myocardium to contract. Also called a flat line. A, if you put A at the beginning of the word, it means not. So no systole. Systole is the contraction of the heart. What's the relaxation of the heart called? Do you remember?
Diastole.
Diastole. Very good. Very good.
So basically, to get that, you're dead, right?
Asystole. Well, you're not dead, but you'll probably soon die.
I got a question.
Yes.
Probably should know it. I should probably already know this, but myocardium, what exactly is it?
The myocardium is the muscle of the heart. Cardiac tamponade. Compression of the heart by fluid accumulating within the pericardial cavity. So here you see in blue here, they show this diagram, there's fluid built up where there shouldn't be. Normally the pericardium, which is the membrane that surrounds the heart, just kind of lays flat on the heart. But here there's fluid in there. And the fluid is building up and is pushing on the heart. It's compressing it. That's a cardiac tamponade. Compression of the heart due to fluid accumulation within the pericardium. That might happen because of an infection or something like that. I'm not sure why it happens, but it can happen. Congestive heart failure. Inability of the left ventricle to pump adequate blood to cells. Here's normally your left ventricle, which is this one, should be large, and here it's small for whatever reason. I don't know the reason why it would get like that. But it's the ventricle so small it can't pump enough blood. So congestive heart failure is when that's why. The left ventricle cannot send enough blood up to the cell. Cor pulmonale, pulmonary hypertension and hypertrophy of the right ventricle. So a hypertrophy is an overgrowth of cells. So you see the wall here is too thick.
Bring it in.
Tom Willis. Hey. Yeah, you want me just to call you when we're ready? Because I'm not exactly sure when I'll be ready. So I'll just call you. I appreciate it. Thank you. Okay, bye. Cor pulmonale, or right-sided heart failure, is an enlargement of the right ventricle due to high blood pressure in the lungs usually caused by chronic lung disease. So remember, this ventricle sends blood to the lungs. And if the lungs are diseased, it's hard to get the blood through the lungs. So the pressure builds up, and this side of the heart, trying to get that extra blood through the lungs, gets bigger and thicker. And gets stretched, and that can be problematic.
So is it bigger for the fact that it has more cells, or just that it's swollen?
Yeah, it has more cells. It's grown in muscle size to try and push that extra blood through there. And then having all that extra muscle there isn't usually, you think, oh, it's good, this guy's heart's more muscular, but it causes problems with the electrical conduction system and other things. Embolectomy, removal of an embolus through an incision in a blood vessel. An embolus is a clot that's blocking the blood. And it looks like here they've made an incision and they've stuck something in here to remove this clot. That looks like some kind of tool, and I don't know, I'm not a heart surgeon, that they stick in to remove that clot. Looks like it's on the line here. Interesting. That's an embolectomy. An embolus is a clot that floats around inside your blood vessels. It can stop up the blood vessels. Endarterectomy, removal of the inner wall of an artery to reduce an arterial occlusion. So here, the wall of this artery has a big plaque, a big growth of fat, and they cut it open and pull it out. That's an endarterectomy. And so, if the clot was right here in this artery here, you wouldn't be getting enough blood flow to the brain. That could cause a stroke, and that could kill you.
How would they do that without, you bleeding to death because it's the carotid artery?
That's a good question.
They must have it like bypass.
A bypass, yeah. Good question. There's sometimes that you take the blood out, and maybe have it go through a machine that helps move it. I don't know. It's a good question. A palpitation, an awareness of a heartbeat that is unusually rapid, strong, or irregular. I remember I started getting heart palpitations. Happened maybe about 4 or 5 years ago, and my heart would just kind of flutter a little bit. And I was like, whoa. It happened about 4 or 5 times a day. And my dad's a doctor, and I told him about it. He said, well, if you're older, a lot of older people get it from drinking caffeine. He said, don't drink the caffeine. I'd usually drink a Coke or 2 a day. I quit drinking the caffeine, they went right away. So a fluttering of the heart is a palpitation. Pericardiectomy. Ectomy is a removal, so this looks like a removal of the pericardium for some reason. Excision of the pericardium. So they've cut it open here. Maybe that could relieve the fluid pressure that builds up underneath, or maybe there's you need to get inside there and work on some of the blood vessels. Either way, if you cut this pericardium, that's what it's called. Pericardiectomy. The pericardium is the membrane around the heart. Yes?
When people refer to, they'll say the heart is surrounded by like a fluid-filled sac. Is that what that is? Okay.
It's usually not fluid-filled though.
Well, one of my teachers in the past, he died of a heart cancer. And his heart, was filled. That part was filled with fluid. It
was filled with fluid.
It was like half a gallon or something. It was a lot.
That's what we were talking about earlier. With the fluid here. There, right there.
Yeah.
The fluid in the heart. That's an abnormal thing. Varicose veins. You ever see these? That's phlebitis. Phlebitis is inflammation of a vein, usually in the lower limbs.
How come that happens mostly when you're older?
Yeah, the reason why is because these valves that are in the veins, remember there are valves in the veins that keep blood going in one direction? Well, when you get old, the valves stop working right. It's just like a door that's been open and closed too much. It stops, gets a little bit off, and the valves don't keep the blood from going backwards. And so blood goes backwards a little bit and just hangs out in these lower veins. That's why it's usually in your legs, because the gravity pulls the blood down.
Do they grow outwards?
Yeah, if you ever have a lot of blood in your veins, they'll expand just like a water balloon, and they'll stretch. And that's why you can see them.
Is there still blood?
If you put your leg up, it'll all run back and they'll all go back down.
They disappear.
Yeah, they'll disappear. Put your legs up. Is that interesting?
Yeah, my mom has a lot of those.
Yeah, that's what you all have to look forward to when you're old.
I have
Yay.
The alternative is death. That's the alternative to not getting old. But actually, they have ways of laser treatment or something where they can treat them somehow, and I'm not sure how that works. But yeah, the problem is with the valves. Phlebotomy. Incision or puncture of a vein to withdraw blood. A phlebotomist is a guy that comes around and withdraws blood. They wanted to train me to be a phlebotomist one summer when I worked at the hospital. But I said no. No thanks. You got to go around drawing blood from people and stuff. I wasn't drawing blood. But it paid better than the job I was doing delivering charge, but I still didn't do it. Sinus rhythm, the normal cardiac rhythm regulated by the SA note. So this is a sinus rhythm is a normal heart rhythm. That's sinus rhythm. That's what it should look like. Thrombophlebitis, formation of a blood clot in a vein in response to inflammation of the venous wall. So we've got some inflammation in the wall of this vein, and a clot has formed. A clot is like a big scab, and it's formed inside your vessel. A big scab that forms inside a vessel is called a thrombus. So this is thrombophlebitis, and that'll block up the vein. Sometimes when they're sticking you to take blood, they can end up causing that. If that thrombus breaks loose and starts traveling, you know what it's called? It's not a thrombus.
The thing you just talked about.
Yeah, I just talked about it earlier.
Starts with an E, doesn't it?
It does start with an E. Do it, Drew.
It's
called an embolus.
Embolus, okay.
An embolus. So if that clot breaks free and starts traveling, it's called an embolus. And if it lodges in your heart or in your brain, that could be trouble. You don't want clots inside your blood vessels. A valvotomy is incision of a valve. They're cutting into a valve of the heart, maybe here. I don't know why they would cut it, but you have to ask the surgeon why he's cutting your valves. Maybe to fix them.
Can I take that test for check on
So you're just strolling in here saying you're going to take the test. Is that true? 15 minutes. And then finally, a venography. Injection of radio-opaque solution into the vascular system for X-ray examination of veins. This is the same thing they did in the arteriography. Looking at injecting a radioactive substance so you can see the veins. In an arteriography, it's seeing the arteries. In a venography, it's seeing the veins. Can you see those veins, Malcolm? What do you think about those veins? You don't have much of an opinion, and that's because you're not a doctor.
Good for you.
Okay, those are the clinical terms About 4 or 5 questions like that about those will be on the test. Can you keep all those straight? I'm going to show you a little video, and then we're going to spend the rest of the time on IDs. Right?
Should I keep it banged?
No, you can turn that thing
Turn off
off.
the video.